My name's Karen. I'm 38 years old. I am a proud mother of two beautiful children that I'm really, really happy to be able to raise. I was raised out of a suitcase, so that was something I always struggled with. I didn't know really where I was from. My mother's Métis, so I'm Métis, but that's not something that I was really raised. I didn't have a sense of identity when I was young.
My name is Hawkfeather Peterson, and I'm a parent of 6 kids, and fairly recently, in the last few years, I've started working as an advocate and an activist for drug users. I'm on the board of directors for the Canadian Association of People Who Use Drugs. I'm the Vancouver Coastal representative for the BC Yukon Association of Drug War Survivors. I do outreach and peer work on the Sunshine Coast where I live. I sit when I can with the Overdose Emergency Response Center. Lots of stuff, really.
I'm Denise Bradshaw, and I'm the Director of Provincial Health Initiatives at BC Women's Health. I'm a social worker by background, and for the last 25 years I've been working in the field of mental health and substance use with a particular interest with women. I do this work because I know that I'm one step away from having those exact same experiences as a woman. And in the work that I've done with women who are using substances and potentially pregnant or parenting, I see myself as walking shoulder to shoulder with them. I feel that it's extremely important as a healthcare professional that we remove the power dynamic in this work as much as possible. Can't make it go away completely, but we can shift it dramatically.
I had a lot of addiction and alcoholism in my family. Addiction caused my grandfather to take his life, and apparently my auntie as well. So I think I was raised with that being a norm. And I guess I started realizing I had a problem when I was about 16 years old. I started using when I was about, maybe 11, and daily by the time I was 12. I started going to meetings when I was about 17, but just, I don't know, I never would go back. I didn't feel like I had much support. I then got pregnant with my daughter, and I didn't think I could even keep the pregnancy, although that's all I wanted was a family, because I didn't have that. And I just wanted to have my own family. So I didn't think I'd be able to keep her, but I found a really awesome doctor who specialized in methadone and pregnancy, and she said no, that wasn't the case, and I did my research and realized it wasn't the case. I could keep her. But it was hard because a lot of people were telling me I couldn't do it because of my history.
I think that there's still a lot of pretty archaic views around what recovery looks like. And it took me a lot of years to learn that it was okay to actually love myself as I am, rather than thinking, one day I'll be what society expects me to be, and then I'll be an okay person, and then I'll be good, and then I'll be worthy of, being seen as someone that's actually beneficial for our society on any level. And that stigma, it's the type that, it's internalized, it penetrates you deeply. It's like the rest of the world sees you as lesser. And that affects every aspect of who you are, really. People have all sorts of views about what it means to be a substance-using parent, and a lot of them are not formed from actually ever meeting a parent that uses substances. They're from cliches and movies and, terrible, not at all based on actually getting to know anyone and seeing their story and knowing what it's like.
I remember clearly when I was like 8 weeks pregnant, or maybe a little over that, I started bleeding, and I thought that I was going to lose her. And I went to a doctor, and a walk-in clinic, and he said, "Oh, you're probably having a miscarriage." And I looked pretty shocked and upset. And he basically said, "Well, the baby probably doesn't want you." And I remember that clearly. So I did go to the hospital many times for help and always encountered a lot of healthcare professionals that were really cold and basically treated me like it was pointless in even helping me. Or really no depth of compassion, and it was really hurtful. I felt like I was less than human. I was treated in that way and ended up always being discharged to go back to the street.
So planning for his birth, we had planned to have a home birth, in part because it eliminated those awkward conversations with care providers where I have to explain that I'm a substance user and then guess how they're going to respond, because there isn't really any sort of universal standard for how care providers respond to substance using patients in perinatal settings. So we planned a home birth, and our midwife was very understanding, and she knew I was on maintenance therapy. And that didn't end up being what happened, as birth goes. He, stopped kicking, and we decided to kind of go in to get a fetal movement count to just make sure he was okay and check his heartbeat. And when we went in, he still wasn't moving. So it became very quickly a very emergent situation, and I was prepped for a section very quickly. So it all happened so quick that I had a general anesthesia. So I wasn't actually awake, and my partner wasn't allowed into the room. So we weren't actually there for his birth, as much as that's true, because I was there, but I wasn't actually cognitively there. So he was born, and when you have a general anesthesia, some of the meds get to the baby. It's very, very common for a baby to come out floppy and a bit groggy. They need a little extra oxygen. They need a little extra stimulation. But at some point, someone glanced at my chart and knew I was a substance user. So when he came out floppy, I don't know if the assumption was that I had done something wrong causing this emergency. I don't know what happened, but someone in the room decided to naloxone him. So on top of coming out a bit floppy, he then was put into basically shock. All the opiates went out of his system, and he needed some pretty extensive resuscitation. So it took about 47 minutes for them to resuscitate him. And in that time, because we were in a small hospital, they didn't quite do it properly. So there was a period of about 3 minutes he didn't get any oxygen to his brain. So he has what's called an HIE, which is hypoxic ischemic encephalopathy. So a brain injury, an acquired brain injury from oxygen deprivation. And I don't know what role being Narcaned at birth had in that, but I know you're not supposed to naloxone a baby that's had methadone. I know that I hadn't used drugs, so I know that wasn't what was going on. I know there was no chance he was overdosing. And I'll never know. I'll never know what role that played, but I'm mad as hell about it. And it shouldn't be a question I even have to ask.
I was in the hospital. I made sure that I asked for help every chance I could. And I ended up meeting the head of addictions at St. Paul's. And she was amazing. She asked about my life, and I told her. And she was so caring, and she just, she didn't bullshit me. She told me what it was, that there was a good chance that if I used again, I'd die, and I couldn't, and I knew this, but she asked about my children, and she treated me like a human. She treated me like a person, and an intelligent person. She treated me with a lot of empathy, and that made all the difference in the world. she suggested to me that I may have something called PTSD. And I was like, maybe. That would make a lot of sense. She told me about a treatment center she thought would be really good for me, and it was called Heartwood Center for Women. I ended up meeting my social worker, and the first thing she says to me is, well, you're really lucky to be here because the ministry was going to put in an order for continuing custody for my children. With 2 days later, I had arrived 2 days prior to that taking effect. And knowing that I was Métis, she really promoted an understanding of culture and suggested I go to a sweat. I ended up going to this amazing ceremony, and when I came out, I felt just clean. I can't explain it. I just felt like I'd had the most cleansing experience of my life, and that's what it's supposed to do. It's a purification ceremony. And I came back to the treatment center that night, and I told the nurse I don't want the methadone. And any other doctor or anywhere that I'd been, I tried to go into detox to get off methadone before, and they said, no, you can't do it. And then if I'd go to a doctor and ask, they'd be like, oh, well, you'll probably relapse. But the nurse who was on that night, she said to me, are you sure? And I was like, yeah, I'm sure. And she's like, okay then. And then I guess she talked it over with the staff, and they were very supportive in that. I mean, they were a little shocked, in disbelief, definitely, but they supported me. And I really truly believe that when people have the support of others and a community of people that are wanting the best for them, that it happens.
It's a huge source of empowerment to get to know a drug user community and to be heard, right? It takes something that was this tiny secret just that eats away at you, right? It's just, you define yourself in such a negative light when you have a secret like that the rest of the world sees as such an ugliness. And once it's not, and you can be open about it, and when you can meet other people that maybe feel ugly, and you can be like, oh, you didn't even know there's this whole other reality where you're allowed to actually think you're great, and you're allowed to not, be waiting till you're sober to be seen as, valuable. You're allowed to just think you're great now. And that's really nice. Yeah. If I'm talking to care providers that are, seeing expecting parents, I like to point out to them that, care should be evidence-based. It shouldn't be based on archaic stereotypes. And too often those lines get muddled. There's a lot of care that happens when it comes to substance users that are still based on perceived notions of ethics, as though there's something morally questionable about being a drug user. And abstinence is the magical cure for that. And that gets ugly. That's not an acceptable way to be ever treating someone when you're their medical care provider. It needs to be evidence-based practice.
I think if we want to say what is the antithesis of addiction, we will say connection. And that people who have connections to community, to family, to individuals, and to their healthcare system in a way that is respectful and dignified, they will do very well and their needs will be met. I think that recovery is not only about achieving abstinence. Recovery is really about achieving wellness and healing.
We're still unique individuals. What is the case for one person will not be for the other. Some people really want recovery, and in their mind's eye, recovery is abstinence, and those people deserve to be supported in that. For some people, recovery just means using safer, using in a way that's not detrimental to their family or their professions or their jobs, anything like that. But I think listening is key. Listening without, those preconceived notions of what substance using looks like. You know, we've had a lot of wonderful allies for decades trying to do really amazing harm reduction work. But when it comes right down to it, what's going to actually affect us in a day-to-day life and what we're going to actually use, that has to come from substance users. I think what it needs to look like is us having a seat at the table at every level of government. I think it looks like peer navigators and coordinators at every health authority, at every hospital. I think when it comes to forming the guidelines for prescribing and for all of it actually, that there needs to be peer engagement before guidelines are actually approved to be put out to, to care providers and anyone.
Women are very powerful, and we don't really acknowledge how much having the support of them around us means. But while I was in Heartwood, I started to develop some really good bonds with women, and I'd never had that. I didn't even have a good bond with my own mother, so and I learned how to ask for help. And I met people that just treated me as a human, like a person. I can't even begin to express how grateful I am to that. Because of that, I've continued going to ceremony and learning my culture and teaching my children that. And I have some beautiful female friends now. I have a strong network of women that have my back.
You know, when I think about how my relationship to other drug users affects my journey, a really big component of it is empowerment. You know, I've seen something shift in me that previously something that defined me to the outside world as really a piece of shit became something that I was all of a sudden respected for. I was all of a sudden an expert. And me, changing from being a victim that was stigmatized and oppressed, I became an advocate and an activist, and helping other substance users has changed everything for me. People are proud of what I'm doing, so I'm proud of what I'm doing. And I know I'm making a difference to people. I know I am. At the end of the day, I can see things I've actually influenced that are benefiting people, saving lives even.